Hey everybody, happy Friday. I am here with your update and I'm going to be quick today. So we have had a lot of new patients coming in and I feel like we're falling behind a little bit by not getting their pictures to put on Facebook in our new arrivals photo album. So I just wanted to remind of the right way to do this. When you have a new puppy or kitten especially, or even just a new pet, snap a picture with the hospital or resort phone. This works for both hospital and resort, and text it to me with their information. Make sure that it's okay for with the owner that we posted on Facebook and to get them really excited about it. Text it to me and then I'll make sure to post it. In the near future, I'd love to come up with a system to where you guys can post those on your own in real time, just as you take them. So maybe some apps from the phone or something like that will be coming in the next couple of weeks. So stay tuned for that. Also, I've noticed a lot of activity in Slack and I'm really excited for that, especially recently. And one thing that I've really encouraged you to do is use the praise feature when you're giving a compliment. And then also last week I asked, when you're doing that, to maybe not name multiple people per compliment, because we were going to try and use that for determining an employee of the month, putting a couple people in the running and being able to choose from that. Well, I understand that praise is not working for everyone to use, so what I'd like you to do is, in the meantime, just go ahead and praise somebody by just typing a compliment and tagging them in it. So it might say something like, great job on this, that, or the other, and you put at whoever you want to do to tag them in that. So y'all know how to do that. Just type your compliment there. Don't worry about trying to use praise or feeling limited by that. Also this week, I sent out a couple of videos that I want to make sure that you've had the time to watch and listen to. The first one that's very important was about our December promotion for saving on teeth cleanings and spays and neuters. So that was $50 off of teeth cleanings that were scheduled and done in the month of December, and the $30 off of spays and neuters scheduled and performed in the month of December. So we've publicized that through all of our regular avenues to clients, and we're even going back and making direct phone calls to people who've had those services recommended in the last couple of months and encouraging them to come in. So I'm really hoping that my front line of defense, my team who answers the phones, is making sure to connect with people on those opportunities for them when they're scheduling, and making sure to make notations so that that's not forgotten or missed. And then I'm also hoping that the team members who work in the exam rooms and make those direct recommendations from clients are encouraging them with that information and those opportunities so that they can really take advantage of them, and so that we can have an appropriately full schedule for the month of December. Very important that all those things happen. Don't forget at the resort too that you can make recommendations like that. If you're bathing a pet, or if you are giving a medication and you notice a lot of dental disease, please connect with a team member who can appropriately make a recommendation to the client on those opportunities for their pet, and make sure that it's something that really is a viable option for them. But make the recommendation, because that's really where it starts. Dr. Bordelon's back. Welcome back, Dr. B. We're happy to have you back in the swing of things. Dr. Mark still does have some limitations following his surgery. I'm amazed that he's up and doing as well as he is, but he's limiting himself from doing procedures until February. So you'll notice that he's scheduled for appointments on those days, and that we have different doctors scheduled for procedure days each other day of the week. So make sure that you pay attention to that schedule and don't get back in autopilot and just schedule something accidentally. And be really ginger when you're describing that to a client, because we want to respect his privacy and let them know that he's available for other things that they have needs for. Also, this week we came to learn that because we use courier services for IDEXX and for Antech, and we have those samples picked up directly by a runner from our practice, that it's really been difficult to coordinate with FedEx additionally. And so we have to make sure, if we have a sample or a package that we need to send out through FedEx, maybe it's something that comes with a prepaid label, so we don't have a choice of another service and we have to use FedEx, we have to directly call to schedule a pickup person to come and receive that package, or coordinate in some kind of way to get it to a FedEx drop-off location, which is sometimes hard with samples and things. So long story short, you have to call FedEx if you need a package picked up. It's not automatic anymore. They don't come every day. Dr. Kristen this week helped us out by changing the key to the compressor door outside on the hospital side. And this is something that was previously keyed with a specific key, and it made it difficult for us to get that going and turned on in the morning. So now we've rekeyed it, and we actually have a spare key available to you so that closet can lock, and it is hanging on the side of the fridge by the food prep area on a big obnoxious looking keychain. So I'm sure you'll find it there, and let us know if you have any problem with that. Also, this week we have started, well, last week late, we started having managers on call for you to call into, and seemingly that's been going pretty well, but some team members have complained that it's been difficult to find who is on call so they know exactly who to connect to. So I wanted to share how to do that. What you're going to do is just do this prophylactically. That way you know how to do it whenever you have the time of need and you're not challenged on multiple fronts at once. So now, after you watch this video, go log into your Humanity app on your phone, and click on the manager on call through shift planning, and see if you can see their name listed there. If you see somebody assigned for today and tomorrow, you know that that's a way that you can get there. Otherwise, you can choose all positions and look for that manager on call, and then choose a position view. There's a couple filters, so go looking for it so that you know you can find it. And if you can't find it, come find Melinda or I, and we will work with you in your app, try and change some settings so that it displays to you properly. Okay? Again, try and do that after this meeting so that you make sure that it works for you. Also, this week, through some conversations at meetings that we've had with doctors and management team, we have decided that because of the size of our practice and the volume of hospitalized cases that we're seeing, it's just not as efficient as it used to be to autoclave IV lines anymore. So what we'd like you to start doing is use one IV line per patient. So if a patient stays in the hospital for a couple of days and you're changing the bags, you can continue to use that line unless otherwise directed by the doctor who's overseeing the case. After that patient's discharged from the hospital, we can dispose of that line. We won't re-autoclave them or save them anymore. The only exception to that would be surgery patients. We're not changing the protocol on how we manage surgery patients, IV fluids and lines at this point. If you have questions, again, for further clarification, you can see Melinda for that. Last situation that we want to try and modify and make better is, I know there's been some confusion, especially since we've started 24-hour care and we're transferring cases amongst doctors, and then also adding in whiteboard and hospitalizations and getting used to that new process. I wanted to try and clean up a few little snags that we've had in our process to smooth it out a bit. So one thing is, some doctors and some teams are wondering how to choose which doctor to transfer cases to. In other words, if there's a night doctor who has hospitalized a case and they need to leave in the morning and transfer that over, they might not know exactly which veterinarian to choose to take it over for the day case. So what we're going to try and do is give them the discretion to transfer it back priority to a doctor that client and patient have maybe had a prior relationship with. If that's who they regularly see, that's who we'll choose to transfer that case to. The exception to that may be if that doctor is seeing procedures that day. I don't think it's fair and reasonable to add on a larger than normal hospitalized case list to a doctor who is committed to seeing procedures that day. So the doctors understand now exactly how to fairly distribute those out, and they have kind of a little algorithm for themselves to do that. We're going to try and put that in writing and share it, especially with the treatment room nurse team, and especially those first who are working overnight, because a lot of times you'll need to prepare cases and go ahead and enter the treatments in whiteboard for the doctor who will be receiving the case. For the team who attends rounds in the morning and needs the day doctor to take over a case, there's been some question in the air about when do they see this patient? When do they examine them? And we haven't been able to pinpoint a precise answer or a protocol that fits all. And I'm a protocol person, so I struggle with that a little bit, but an overview of the greater good is really what we have to do per patient, and we have to schedule appointments that those doctors are going to see during the day. So it makes it hard, and it might be unreasonable to have a protocol to say we would see every patient in the morning before we start seeing scheduled appointments. I don't think that's reasonable because not every patient needs to be seen right then. They may have just been recently examined. There may be no change. So what we're going to ask you to do is, if you're on that receiving day doctor's team, stand by your doctor at rounds, have those clipboards, and right after rounds concludes, have a little mini huddle with your doctor, or have a huddle with the doctor as soon as they walk in the door, and they will decide at that point which patients they want to see and when. They'll communicate to you those details to you, and you can organize your day accordingly. So again, couple elements here. The doctors understand now a simple solution on how to determine who to transfer those cases to. They'll utilize the treatment room nurses to help to organize this and get whiteboard settings and treatments planned accordingly. The incoming day teams will receive these from the treatment room nurses, have those ready, stand by their doctor at rounds. Right after rounds, they will huddle and decide which order to see patients, which priority, which time, how those are going to be done through the day, and discuss any kind of changes that may happen at that point. Please remember that no system is ever perfect when we first start it. And so this is a part of smoothing that out, and it may not be the end solution. So if that doesn't work, if it's not sufficient, you have to give us feedback on that. That's how we got to this point as it is somebody bringing wonderful feedback forward to say what we're doing wasn't working. So this is the next phase. We'll try this, and then if it's not the best, we'll keep trying. Continuous self-improvement, right? That's what we're all about. So give that a shot. I'd like to see that start right away. Next opportunity that you have at rounds. I hope you have a great weekend, and I hope this was a helpful update.